My second priority is going to be public safety. I told you that my number one priority was giving the citizens a voice. My number two priority is public safety because it is very imperative that the citizens of Memphis be able to live in an environment that they can feel as though they're safe. If they have medical needs, they're going to be attended to. And you need some of the best qualified, best quality individuals to fill those needs. In the past, we have had police officers and firemen with bachelor's, master's, and we even have some that have PhDs. Now, in the public sector, when you have individuals that have acquired that status, their qualities are paid for. Now, just because police officers and firemen and other city workers, electricians, sanitation workers, plumbers, heavy machine operators, understand that the city government is set up to provide core services to the citizens of the city. It's not a company or a corporation that's set up to produce widgets and gadgets and digits for sale. We sell services is what we sell. And that's because the citizens pay their tax dollars so that they can have the availability of these services. In order to have quality services, we need to be able to recruit and retain individuals that look at this as a career. You have individuals that love the idea of service. As I told you earlier, I served my country for 21 years, service. I've served my city for 16 years already, service. My life has been a career of service. And there are numerous other individuals out there that's what they want to do. I want to make people happy. I want to make sure that people are taken care of. But I also want to make sure that my family's taken care of. We need to make sure that we get back to the level of police officers that we had when they said crime was down, because we've noticed an increase in crime. We went from being the fourth most violent city in the nation per capita to the third most violent city in the nation per capita. We have one of the best fire departments in the nation. It has been recognized as one of the best fire departments. We have one of the best airports in the world and all of the service workers out there. We still have our own sanitation department. We still have our own utility, MLG and W. You don't have a lot of major cities our size that still own their own utility, which is worth $3.2 billion. That belongs to the citizens of the city of Memphis. And we need to make sure that we still have qualified individuals that have the ability to run those services, to run those utilities. Now, the city of Memphis, for the last 50 years, has not paid into the Social Security system. And most city employees, MLG and W workers, airport workers, we rely on our pension. We have individuals that have given 30, 40 years of their lives, the best years of their lives, to this city. That's why it's imperative and so important when you see city workers out there fighting for their pensions and their health care. Because back in the 80s, we used to be under TennCare, Blue Care, but the city of Memphis decided that it wanted to be its own insurer. So there was an agreement worked out that there was a 70-30 split. The city would pay 70%, employees would pay 30%. We have individuals now that have retired and the city wants to go back on the obligation of paying for their health care. Some people only get $1,000 a month retirement. They rely on their health care. We've stressed a lot of retirees out because we put the post-65 out of the healthcare system. A lot of employees took a 4.6 pay cut. Employees have had to pony up to the table and give an additional 1.5% to the pension fund, and you're still taking it away anyway. So what would draw young people to this city? Because if you're going to be policemen, firemen, we got 80-year-old sanitation workers out there still on the back of a truck, but that's because they can't retire. We still got individuals at the airport and over at MLG&W who now don't know if they want to retire or not because they don't know what's going to be the disposition of their health care. And we have individuals that have critical illnesses that rely on their health care. Now, we should not abandon those individuals. And I'm not just saying that because I am a city employee. I don't have city health care. Because I retired from the Army, I have what you call TRICARE. But I'm going to fight to the finish to make sure that these individuals get what they need. You're going to have a lot of people in the private sector that say, well, they took mine, why should they have theirs? You get Social Security. You have the availability of the National Health Care Act. You chose to be a private sector individual, and there's nothing wrong with that. But also, let's honor the obligations that we have to the individuals that have made our lives a little bit easier.